aligners are a wonderful implement in our armory, but they cannot solve all the cases. My name is Dr. Samir Sheikh. I'm a practicing orthodontist in the beautiful city of Dubai for the past 2 decades. They are challenged in a lot of areas, and the traditional orthodontics will always have its place under the sun. My opinion is people are moving towards aligners, but they can't offer the entire gamut of our orthodontic appliance. DIY cannot solve everything because at some point of time, you need a human interference, someone who knows the basics and the consequences of what you're going to do, not just moving teeth. There are a lot of other things involved. It's adjustment of your occlusion, what can happen to your temporomandibular joint. I mean, these are matters of concern where a human factor or an orthodontist can involve and prevent the consequences. So DIY, yeah, for some mild cosmetic work here, they're fine, but not for majority of the procedures.